Okay, let's dive in. Today we're going to unpack something that is truly strategic when it comes to protecting yourself after an injury, your medical records.
It sounds so administrative, but it's not. These documents are the absolute foundation of any injury claim, especially in, say, car accident cases.
Exactly. Our sources really zero in on principles that apply everywhere, but we'll use some specific examples from places like Aurora, Colorado. And our mission is simple.
We want to show you which documents really matter most.
And why just one missing detail or even a small gap in your timeline can basically give the other side all the leverage they need.
What's really fascinating here is how fast that legal clock starts ticking. I mean, the source material is really clear on this. Right after a crash, even if you feel okay, you have to get an evaluation.
But I'm curious about that. There's so much social pressure to just, seem tough or say I'm fine and just go home. Does that really outweigh the legal risk?
It just doesn't. Not at all. Waiting, it severs what we call the indispensable time-stamped link.
The time-stamped link.
Yeah. If you delay, the opposing lawyer will immediately argue that whatever injury popped up a week later, it wasn't from their crash. It just creates doubt.
About causation.
And that's their entire strategy.
Hmm.
So those initial ER reports, the first doctor's notes, they are your first line of defense. They lock in the timing.
And you can't argue with visual proof, right? I mean, we're talking about the initial diagnostic tests, x-rays, MRIs, things like
That's
that.
precisely. They aren't just for diagnosis. They are, for all intents and purposes, legal exhibits.
So testimony is one thing, but an MRI showing head trauma.
It's just legally superior.
Yeah.
We saw a case out of Aurora recently where the initial ER visit was a little vague, but the CT scan they did right after, it provided that definitive objective proof. It saved the entire claim.
So getting past that first 24 hours is just the start. Now you have to show that the damage isn't just temporary. How do you document that long-term impact?
This is where consistency is so important for your credibility. You move from those initial reports to tracking the whole recovery story.
Your follow-up appointments, pain tracking.
And crucially, your physical therapy documentation. These records aren't just showing you got treatment. They're proving your struggle to heal.
I was surprised the sources spent so much time on PT notes. They can seem so, I don't know, bureaucratic. Why are they so vital?
Because they help define a concept called maximum medical improvement, or MMI. They document when your healing starts to plateau, and if you have pain flare-ups and missed sessions.
The note from the provider explains it.
It explains why your progress is slower months down the line. It stops the defense from claiming you just, stop trying to get better.
And then a specialist can come in and confirm the permanent nature of the injury. That specialized report is the evidence that moves the conversation beyond just temporary pain.
Absolutely. So once you've established the physical damage, you have to connect that to your actual daily life and to your financial loss.
So we're talking about those doctor's memos, right? The ones with restrictions like cannot lift more than 10 pounds.
Exactly. Those details are the translation device. They connect a physical injury to a real, quantifiable financial or emotional weight.
And we can't overlook mental health records.
No, absolutely not. Post-accident trauma often involves things like anxiety, chronic stress, PTSD. If you see a therapist, those documents quantify the non-physical damages.
And if those issues make you miss work or you can't do your job as well?
Then those records directly substantiate that loss of income. It's all connected.
The source material is so clear about this, especially in a place like Colorado. The law expects a crystal clear timeline. Any gaps are instant red flags.
And they invite the other side to question your entire claim's credibility.
So how do you protect that narrative?
Okay, so organization is your best defense here. First, create a filing system. Folders, binders, whatever works. And digital backups are essential.
Right.
Second, keep a journal of your symptoms. Write down what hurts, when it flares up, and exactly how it stops you from doing basic things. Not just work, but cooking, cleaning, even sleeping.
That symptom journal, it provides the personal voice to back up all the clinical notes.
It does. And finally, track all your communication. Keep a dated list of every conversation with doctors, therapists, insurance reps. This consistency just makes the whole legal process smoother.
It ensures your complete and honest story of recovery gets told.
And it protects your rights every single step of the way.
So given that consistency and detail are so essential, here's a provocative thought for you to take away. What daily non-medical events like having to cancel plans with a friend or needing help with a simple chore should you be documenting right now to make sure your full personal story is ready to be heard